Hello and welcome. Today we learn about atrial fibrillation. Atrial fibrillation is a cardiac arrhythmia with irregular heartbeat due to atrial contractions. On ECG, there is no distinct P waves and the pattern is not repetitive. Atrial fibrillation significantly increases the risk of thrombosis and stroke. Now let's look at the causes of atrial fibrillation. For easy remembrance, we use acronym PIRATES. Remember the Pirates of Caribbean? Yeah, the Pirates. P for pulmonary edema, I for ischemia, R for rheumatic heart disease, A for atrial myxoma, T for thyrotoxicosis, E for ethanol alcohol. And then S finally is for sick sinus syndrome. I hope this one will help you remember the causes of atrial fibrillation. Now let us understand the pathophysiology of atrial fibrillation. This condition occurs when a rapid irregular fibrillatory waves from an ectopic foci causes uncoordinated atrial muscle contraction. An ectopic foci may cause abnormal firing over the sinoatrial node, and this leads to inadequate time for atrial filling and further causing inadequate cardiac output. Now let's define three types of atrial fibrillation. We have paroxysmal or self-limiting. This is characterized by recurrent atrial fibrillation episode, more than 2, that terminates spontaneously in less than 7 days. We also have persistent type where atrial fibrillation episodes last more than a week. And the sinus rhythm here is restored by cardioversion or medications. We have the permanent one, or rather the chronic atrial fibrillation. This is atrial fibrillation more than a year, not terminated by cardioversion or medication. So it is important to note that there, in this case of atrial fibrillation, cardioversion is not planned. It's not in the plan. Now we move on to risk factors for atrial fibrillation. These are hypertension. The client could be having an underlying heart disease, like a sinus node dysfunction. We have imbalances that predisposes to arrhythmias, and these are like hypokalemia, that is low potassium, hypomagnesemia, meaning low magnesium levels. They are commonly caused by diuretic use. Atrial fibrillation may also be precipitated by emotional stress and medications. Examples are alcohol, caffeine, theophylline, digoxin, excess levothyroxine, antiarrhythmic drugs, stimulants such as amphetamines, cocaine, epinephrine, norepinephrine, and also we have salbutamol. How is atrial fibrillation diagnosed? We do an ECG, and this will identify the presence of atrial fibrillation. We can also do an echocardiogram, which will show possible valvular or structural heart disease. We can do a transesophageal echocardiography, and this is used to identify a thrombus if it is suspected. A chest X-ray will reveal pulmonary edema, which can also be heard as crackles during chest examinations. The signs and symptoms of atrial fibrillation are 1. Shortness of breath, palpitations, tachycardia, dizziness. There can also be a syncope, decreased exercise capacity, irregular heart rate. On ECG, there will be a rapid and measurable atrial rate, absence of identifiable P wave, and an irregular rhythm. The complications of atrial fibrillation. Firstly, atrial fibrillation causes a decrease in cardiac output and atrial contractions become ineffective. The result is that there will be blood stasis in the atria, which can lead to a thrombus formation. People with atrial fibrillation are at high risk for pulmonary embolism and stroke. The other problem is that the individuals with atrial fibrillation are at high risk for venous thromboembolism. We now look at goals of care for atrial fibrillation. For a client presenting with atrial fibrillation, your aim is to see a decrease in ventricular response of less than 100 beats per minute, a conversion of atrial fibrillation to a sinus rhythm, and also manage the symptoms and prevent development of stroke and embolism. Now let us look at the treatment for atrial fibrillation. We have the pharmacological approach and non-pharmacological approach. The drugs used to treat atrial fibrillation include calcium channel blockers. These ones inhibit calcium ions entry into the myocardium, and therefore it slows conduction in the of the atrioventricular node. Side effects include bradycardia, hypotension, headache, and fatigue. One thing you need to note is that when the pulse rate is below 50 beats per minute, you need to hold this drug. Do not give. Amiodarone is another drug similar in action to beta blockers and calcium channel blockers on the sinoatrial and atrioventricular node. The side effects include dizziness, fatigue, bradycardia, hypotension, and it can even cause a cardiac arrest. So you need to monitor for its toxicity. It requires continuous cardiac monitoring. Dronedarone is similar to amiodarone. It is tolerated better and it sustains sinus rhythm following a cardioversion. We have beta blockers, and these beta blockers block beta adrenergic activity. They are used to control ventricular response. Their side effects include hypotension, bradycardia, decreased exercise tolerance, and one thing you need to note is that they mask hypoglycemia. That's very important. They mask hypoglycemia. The other drug is digoxin. Digoxin acts directly by suppressing the atrioventricular conduction. That's why it's called a positive inotrope. It also increases vagatone. The side effects include bradycardia and may also induce arrhythmias. You need to monitor for digoxin toxicity and its interaction with diuretics and other antiarrhythmic drugs. We have other drugs that are used to manage atrial fibrillation, and these are anticoagulants. These drugs can cause bleeding, can cause epistaxis, bruising, hematuria, and major bleeding. The risk for bleeding increases when they are used in combination with other platelets and other anticoagulants. Let us look at the examples. We have acetyl salicylic acid, what we normally call aspirin or ASA. This one irreversibly inhibits COX-1 and COX-2 enzymes. It also inhibits rhoboxin A2. It inhibits platelet aggregation. Then we have warfarin. Warfarin irreversibly inhibits vitamin K dependent clotting factors production. Remember, warfarin irreversibly inhibits vitamin K dependent clotting factors production. Warfarin has no effect on already formed or circulating factors. Then we have rivaroxaban or apixaban. This one inhibits factor 9 leading to thrombin formation, thrombin dependent platelet activation, and fibrin formation. Lastly, we have dabigatran. Dabigatran acts directly has direct reversible inhibition of thrombin. Dabigatran has effect on direct reversible inhibition of thrombin. Those are anticoagulants: aspirin, acetylsalicylic acid, ASA. We have warfarin, rivaroxaban or apixaban, and dabigatran. Other interventions for management of atrial fibrillation include cardioversion, and it's good to remember an anticoagulant therapy is given prior to prevent embolism. Presence of atrial clots is a contraindication for this procedure, and a transesophageal echocardiogram can be used to detect these clots. Another technique is catheter ablation. Radio frequency energy waves are used to selectively destroy parts of the heart. It is used with persistent atrial fibrillation that is unresponsive to other therapies. It can cause scar tissue formation, which interrupts the pathway for the abnormal rhythm and blocks impulses. In summary, atrial fibrillation is characterized by an irregular heartbeat with no distinct P waves and causes a significant increase in the risk for stroke and embolism. Diagnosis is typically achieved through an ECG. Priority nursing actions include symptoms management, conversion to a sinus rhythm, and prevention of complications. Pharmacological agents, cardioversion, catheter ablation are all techniques used to restore cardiac rhythm or cardiac function. Thank you for watching this video. I hope it has helped you understand about atrial fibrillation. Cardiovascular conditions are commonly tested in NCLEX and other nursing exams. So I will be posting more videos in my YouTube channel. Kindly visit YouTube, look for my videos and subscribe. Like, leave a comment and subscribe. Thank you. Bye.